Hello friends, welcome to Front of Health. So today onwards we'll be doing the answer key of 2023 UPSC exam, which was conducted for the General Duty Medical Officer and Assistant Professor exam for the B.R. Sur Homeo College and NHMC, the Nehru Homeo College, Delhi. So this was a combined recruitment test that is which was a single exam, but the interview will be different. So there will be different interviews for the different post of exams. So the organon post, Materia Medica post, preparatory post, or pharmacy post, professor exam, assistant professor exam, and the general duty medical officer exam. So these 5 different exams, one single exam was combined exam was conducted. It was not computer based like previous exams. It was a OMR sheet based question paper, and it was 150 question paper, which happened in 2 hours. So that is the advantage, difference of UPSC. There will be only less than 1 minute for one question, whereas in AAPGT there will be 2 hours for 120 questions, 120 minutes for 120 question. That is 1 minute for each question. But here it is less than 1 minute, 150 question we have to deal in 120 minutes. So that is UPSC exam. And Materia Medica, if you see, 31 questions were Materia Medica out of 150. So that is the statistics. Or sometimes if you see, you can say 31 if you count in pharmacy, but we are counting the like one in Materia Medica itself. So 31 out of 150. The previous 2016, 2017, 2020 question papers of UPSC, if you see, comparatively 2023 exam is a very easy one, and Materia Medica also most of the questions are very easy. So 2016, 17, 20 question papers we have already discussed, answer keys of Materia Medica, repertory, pharmacy and organon. You can see that in our channel. And if you see the analysis of this Materia Medica part, there is only one match the following question, and all the other are direct questions. So these question numbers you don't have to see. This is based on the booklet series C, but booklet series C based on an based analysis it is. So this will be the order in booklet series C. If you see Materia Medica, 121 to 150 continuous, and one question 59 also we can count it as Materia Medica. And if you see the booklet series B, the question numbers will be different. We will be dealing with the questions in booklet series B. There is nothing much actually, but just for avoiding some confusion I'm telling this. So most of the questions if you see EC level only, and some of the questions from Boric are moderate level, and one question from homeopathy drug pictures by M.L. Taylor, it was a difficult level question, and E.B. Nash also moderate to difficult level, and Clark 2 questions, that is common name, family, etc., and Boric also one moderate question is there. Overall, if you see, around 80% of the questions are easy only from Materia Medica. So that's what. And if you see the source of questions, Keynote and Boric are the main sources of questions. So Boric and Keynote, a mixture of Boric and Keynote, plus as in every year, E.B. Nash one question. Then this time instead of Materia Medica Pura, M.L. Taylor one question is there. Last time it was from Materia Medica Pura. So that differs actually. This and all the rare questions you can get from competitive exam guides or materials and coaching programs. So nothing to worry. You will not have to read all the Materia Medica text in your syllabus. If you are seriously preparing for UPSC, you have to focus on Boric and Keynote. We have already done videos regarding how to read Keynote for the competitive exams and how to prepare Boric for AAPGT or UPSC. And in this video also, we will deal with some questions of Boric, and I will show you from where the questions usually appear in Boric. So how to prepare Boric Materia Medica. So first question, extraordinary craving for apples is a symptom of which one of the following drugs? So for confusing us, they have given antim tart and crude also. So there will be a confusion for people. So antim tart is the answer, as you know, it is from Keynote. It is a Keynote based question. And extraordinary craving for apples. So aloes also covers this symptom, antim tart and allows. And if you see the brackets are very very important. Antim crude is there, that's why antim crude is there in the option also. So extraordinary craving for acid and pickle is antim crude, and apple is aloes and antim tart. So this kind of comparisons you have to see, and this is taken from the Homeo International homeoint.org website. So there you can see some different colored lines and from the keynote if you see. And in boric also there are different colored red color, all those things. That is very easy for understanding the very rare and uncommon particular symptoms. So next question, hearing confused, cannot tell from what direction a sound comes. Very commonly asked question, very repeatedly asked question. Answer is carbo animalis. And if you see the carbo animalis keynote, animal charcoal. One question from first line of the keynote, headache as if a tornado in the head. So this question used to appear in AA PGT and other PG entrance exams of previous years before AA PGT. So here this question is hearing confused, cannot tell from what direction a sound comes. This is a very repeatedly asked question. So this is from carbo animalis keynotes. And next question is bad effects from mountain climbing or ballooning. There won't be any confusion because we have some remedies which are very unique in keynote, and coca unique remedy, unique symptom. So if you see the coca Materia Medica, you can see the last name, bad effects from mountain climbing or ballooning. R-salb also is given in the bracket. So bad effects, they can, whenever this symbol is there, you have to understand that bad effects from mountain climbing, bad effects of stimulants, bad effects of alcohol, bad effects of tobacco, all this is applicable. So similarly, diarrhea of cecal core has come in this question paper with a semicolon or the symbols like this. So this, while reading keynote, you have to very much care you have to give, because in rest talks, headache from beer, in rest talks one single line is there. So after this headache or diarrhea, if they are telling different characteristics, that each one separately also they can ask, as a unique one question also they can ask. So this is one such question. And next is diarrhea, anus wide open, is a symptom of which one of the following? So we might have read this symptom in episode. So answer is cecal core. If you see the cecal core term, keynote itself, again the keynote itself, diarrhea. Like I said, for the case of bad effects of coca, diarrhea, this again this symbol, profuse, watery, putrid, brown, all this they have not asked. Discharge with great force, gambugia, all those things they have compared here, not asked. Exhausting, painless, involuntary, not asked. What they have asked is diarrhea, anus wide open. So after this symbol, this single line also they can ask. Epis and phosphorus also given in the brackets, but here they have not compared this symptom like all the above or just like that. They have given anus wide open, cecal core only in the option. They can actually give epis, phosphorus, cecal core and all the above. That also is a way of asking. Then amenorrhea in young girls with bloating or dropsical extension of abdomen and extremities. So whenever you see amenorrhea in young girls, don't jump into aconite, and as it is a OMR sheet based bubbling question paper, don't jump and answer the option A, aconite. It will make you a negative mark. So with bloating or dropsical extension of abdomen, answer is apocynum. So it is again a keynote of apocynum, amenorrhea in young girls. So whenever you read, you just go through the common name and the family of each keynote remedy and boric remedy. That will again help you. In this question paper itself, different common names and family names are asked. So amenorrhea in young girls with bloating or dropsical extension of abdomen, apocynum. The next question, which drug should be prescribed to a patient who drinks much, eat little? So it's a very unique symptom. There is a great desire for sweet. He is very weak and faint about 11 a.m. Very weak and faint about 11 a.m. Must have something to eat. So if you see very close running options, so the answer is sulfur from boric. So this is a boric based question. The exact lines if you see, very weak and faint about 11 a.m. must have something to eat. Great desire for sweets. So all these are there in this boric of sulfur boric. And the first paragraph and the unique symptoms or the characteristic symptoms of boric are very important. We have to read all these. when preparing boric. So lymphangioma boils, carbuncles with bursting sensation relieved by elevating parts. So this is a very unique modality of a remedy. Vipera, we can easily answer by seeing the modality itself. If you see the Vipera boric, if you see the skin symptom, lymphangioma, exact line, lymphangioma boils, carbuncles with bursting sensation relieved by elevating parts. And according to Borik's Materia Medica, this remedy has a decided effect in drying up milk in women who cannot nurse the baby. Decided effect in drying up milk in women who cannot nurse the baby. So answer is lac caninum. If you see the Boric again, lac caninum, first paragraph. So first paragraph is very important of every remedy. First paragraph is very important. And if you see decided effect in drying up milk in women who cannot nurse the baby, lac caninum. All the lac remedies, common name, source, etc. you have to study. It comes in pharmacy also. So profuse perspiration without relief of the suffering is a characteristic symptom of. So profuse perspiration without relief. Answer is Merksol. It comes in the fever of Merksol in Boric. Profuse perspiration without relief. A fever characteristic of Merksol, Boric Materia Medica. And tubercular deposit begins at the apex of lungs, usually the left, is a symptom of which one of the following drugs? So answer is tuberculinum itself. And tuberculinum, if you see keynote, you can see the one of the unique symptom. Tubercular deposit begins at the apex of lung, usually the left. Phosphorus, sulfur, theridion, all these are there. So apex. So there is a mnemonic for this from coaching programs we get. So left, it is asked left apex or left upper lobe. We know two lobes are there in the left side, that is SPMT for the upper one and cons for the lower one. So SPMT includes sulfur, tubulinum, and phosphorus, myrica, and cons is for the lower. So always cons appears in legs, so you remember left leg or left lower. So cons, carbovage, oxalic acid, rumex, natrum sulf, and syphilinum. And if you see the lower near to liver, whatever near to liver, the right lower lobe of lung, BCKLM, most of the liver remedies, bryonia, chelidonium, calicarb, lyco, and merksol, BCKLM, the first letters. And the middle lobe of right lobe, right lung is SMS, sanguinaria, medorinum, and sepia. And the upper lobe of left is Arsalb and calcarea carb. So this is the mnemonic. You can actually use this for every exam. UPPSC is coming and AAPG 2024. Multiple revision is needed for this mnemonic actually. And next question, headache from beer. I already mentioned it. Rustox is the symptom, Rustox is the remedy, and it is from the keynote itself, headache from beer. So if you see Homeo International website, they have given a different color. So those who have prepared keynote from mobile or from the website, from using this website, this is one advantage. Many different colored symptoms, very unique symptoms are given. But those who are comfortable with book, that only is mostly recommended. But if you see headache, like I said, for the cecal core, diarrhea, and the bad effects of coca, headache, again this symbol comes, headache, brain feels loose, headache, sensation of swashing in brain, headache stupefying, headache as if torn, headache from beer, that is our question. Headache returns from least chagrin. All these are headache symptoms of Rustox. So from beer, Rustox. And consider the following statement: enuresis diurna et nocturna, profuse watery urine, where habit is the only ascertainable cause. So this is a very unique symptom. Nobody will make it wrong because very few remedies are there. Starting with this letter in the keynote, that is equisetum E. Starting with E, only few remedies are there, euphrasia, equisetum, etc. So equisetum keynote, we all read in keynote in our UG times. It is a very small remedy also in the keynote. Only one paragraph length is there. Enuresis diurna et nocturna, profuse watery urine, where the habit is only ascertainable cause. Equisetum hyemale. And the next question, craving for meat, pickles, radishes, turnips, artichokes. This is a very repeatedly asked question. Very much repeated. Many times in many question papers it is appeared. So this is regarding the Abies canadensis. Don't get confused with the Abies nigra. So in the boric first remedy itself, Abies canadensis, Pinus canadensis, hemlock spruce. Common name also is asked. And if you see the stomach symptoms, you can see great appetite, craving for meat, pickles, radishes, turnips, artichokes, coarse food, etc. So this is Abies canadensis. And next question, according to Borik's Materia Medica, excessive irritability and fretfulness together with a thickly coated white tongue are true guiding symptoms to many forms of disease, calling for this remedy. So what are the indications? Excessive irritability and fretfulness, thickly coated white tongue. So if you see these, this is from Andim Crude. Andim Crude, Boric, if you see, the first paragraph itself, excessive irritability and fretfulness together with a thickly coated white tongue are true guiding symptoms. So first paragraph of Boric of every remedy is very, very useful clinically also, for understanding the remedy also. As an introduction, we'll get to know the remedy picture in a paragraph, and it is very much gold mine of MCQs of UPSC and IAPGT. First paragraph of Boric. And which among the following remedies was introduced by Russell and Stock? So it's a commonly repeated question from prover section. If you see, Naja is the answer. If you see the books like Crack the Entrance by Dr. Jidesh TK, it is very nicely given, arranged and given about the provers, different provers. So these some similar ones which are very unique, and only few remedies are proved by some of the provers. So Russell and Stokes introduced Naja to homeopathy. So if you see the Clark, best book for preparing for the common name family parts used is John Henry Clark's Materia Medica, Dictionary of Practical Materia Medica. You can see in the first paragraph of characteristic itself, it was introduced into homeopathy by Russell and Stokes. Russell and Stokes. So you can see Naja tripudians, Cobra di Capello, Wooden Snake of Hindustan, Elapide is the natural order, tincture of the fresh virus in the sense the venom, and titration of sugar of milk saturated with fresh virus. So the Clark is very, very good for studying all these things, and it is a clinical Materia Medica also. And infallible for stopping a cold commencing with sneezing. So cold commencing with sneezing, infallible remedy for stopping it. And discharge thin watery like raw white of egg are characteristic symptom of natrum mure. So natrum mure Boric, if you see, the first paragraph itself says discharge thin watery like raw white of egg, infallible for stopping a cold commencing with sneezing, natrum mure. And craving for bacon, ham, salted or smoked meat is a characteristic symptom of which one of the following drugs? Calcareous is the answer. And if you see Boric, again Boric symptom, stomach section of calcareous, if you see, craving for bacon, ham, salted or smoked meat, and this is from calcareous, Boric. And eczema of anus and hands is a characteristic symptom of which one of the following drug? So it is a characteristic of Berberis vulgaris, and Berberis vulgaris, barberry, the common name is very, very important. All the berries we have to combine and study repeatedly, we have to revise and study. So Boric, Berberis vulgaris, if you see the skin symptom, eczema of anus and hands. And hobnailed liver of alcoholics, one of the very unique question, previously appeared in some question papers, so that's why it is added to the question bank, and it is repeated in the 2023 UPSC also. This is the importance of some Materia Medica books, and like V.K. Chauhan's UPSC and MD. That book is very important and unique because a lot of previous question papers are discussed in that. So one who have covered all the 1, 2, 3 parts of that book, we will get a very good exposure to old questions like this. Hobnailed liver of alcoholics is a symptom of fluoric acid. Fluoric acid is the remedy, and it is from Boric. If you see the first paragraph, hobnailed liver of alcoholics, and there will be some unique names, unique doctors, contemporary homeopaths names will be given by Boric. That is very, very important. Even Dr. Nash also gives that, and it is a rare, not repeated, very like little moderate to difficult level question. But if your Materia Medica teachers are like referring these books and coming, or you have a habit of going to library and reading some of the books simultaneously when you read from the Boric and keynote, if you have a habit of reading this in your UG time, this kind of questions you can actually answer, and you can get an advantage of getting over others of the exam. So among the following potency, identify the potency of magnesia phosphorica used by M.L. Tyler for the treatment of dysmenorrhea. So we will have a tendency of answering 6x and all, because always MagFos 6x is used practically by our colleges, teachers and all, but the answer is CM potency. one of the very higher or highest potency in the centesimal scale. Cm potency was used by M.L. Taylor. It is described by her in her homeopathic drug pictures by M.L. Taylor. But one's chief use for MAC-Force has been in the treatment of dysmenorrhea. Single dose of CM given just any time the patient happened to come up, not necessarily during the painful period, have cured for us quite a number of cases. The indications being dysmenorrhea with violent abdomen pain. So there also we have to check the indication. Dysmenorrhea with violent abdomen pain, doubling the patient up and only relieved by heat. This is the indication for MAC-Force CM potency. And according to E.B. Nash, one of the very important comparative Materia Medica, where he compares a lot of remedies and the modalities, and we'll get a clear picture why this remedy and why not that remedy in this case. So there, this question also shows the relevance of that Nash Materia Medica. E.B. Nash, the pains of intractable cases of chronic rheumatism are aggravated in the daytime in the case of. So this is regarding a modality aggravated in daytime. So medorinum is there, syphilinum is there, tuberculosis. So medorinum and syphilinum is compared by E.B. Nash. Answer is medorinum. If you see the medorinum Materia Medica, you can see like very good. Have had seemingly very good results from this remedy as well as syphilinum. So medorinum as well as syphilinum in intractable cases of chronic rheumatism. Our question. The most characteristic difference between them is that medorinum, the pains are worse in the daytime. Our question. So answer is medorinum. And with syphilinum in the night. So this is what from E.B. Nash. So people may be thinking how we will read all these Materia Medicas, but if you have a habit of reading one by one simultaneously from every Materia Medica for a long time preparation, for those who are preparing for 2024 AAPGT, they will have a lot of time daily. So one remedy you take from Materia Medica, Allen's keynote, then simultaneously you read the first paragraph and the unique symptoms of boric and the modalities and the relationship part, and also you read from the Nash, which is a comparatively very small Materia Medica. 1 or 2 pages will be there, or 3 pages will be there from the remedies, and it is compared also. A lot of information will get, and one of the importance of Nash Materia Medica is a lot of cases will be remarkable cured cases will be discussed from his own cases diary or from the contemporary homeopaths records. So this is one very important and very good Materia Medica for comparative study. And next question, Clematis erecta belongs to the family. So this can be considered as a pharmacy question also. If you count like that, Materia Medica will be 30. But if you count this in Materia Medica, because it has come along with other Materia Medica questions, we have counted this in Materia Medica itself. So Clematis erecta belongs to the family Ranunculaceae, and we can see in the family of family, some of them are given in keynote also, but we used to always refer J.H. Clarke's dictionary for family. So virgin bower is a common name, and Clematis erecta, virgin bower, always asked question, and Ranunculaceae is a natural order. Part used is tincture of leaves and stems. And next question, Folkrot. Folkrot is a common name of Arnica. So Arnica, many common names are there. Leopard bane is always asked. Folkrot is there. Family is Compositae. And if you see, next question, according to Boric's Materia Medica, palpitation and cardiac pain while sitting, better by moving about. It is a unique symptom of McMurray. So if you see the McMurray Boric, heart symptoms, palpitation and cardiac pain while sitting, better by moving about. Then you see the next question, rheumatism affecting the bellies of muscles. Everybody will answer this because it is a keynote and unique symptom which we study from the keynote. So actia racemosa, simicifuga racemosa, actia racemosa, if you see the last line. So rheumatism affecting the bellies of the muscles, pain, stitching, cramping. So keynote, again keynote question. Every sound seems to penetrate to the whole body, causing nausea and vertigo. Is a characteristic symptom of. Again, another keynote of Theridion. Theridion, if you see keynote, every sound in homeoint.com, they have given in red color some of the symptoms. Vertigo also, closing the eyes, lacusis, thuja and Theridion, LTT we used to study. And opening the eyes, tabacum, looking upwards, pulsatilla and silesia. So this kind of comparative brackets are very important keynote. So if you see our question, every sound seems to penetrate through the whole body, causing nausea and vertigo, Theridion keynote. And dislocation of patella on going upstairs, one of the very interesting keynote of cannabis sativa. Dislocation of patella on going upstairs. If you see here, one small spelling mistake is there. It is patella, dislocation of patella on going upstairs, cannabis sativa. And fright followed by suffocating attacks. So suffocating attacks, Sambucus nigra. If you see the boric materia medica, exact line is there in the mind symptoms. Constant fretfulness, very easily frightened, fright followed by suffocative attacks. And 59, consider the following statement of William Boric. So again a Boric question. This is indicated in the renal affection. So we will understand that this is from a first paragraph. By seeing the language, by seeing this structure of the Boric materia medica symptoms, we'll understand from which part it is asked. That's why very, very important it is to read the first paragraph of Boric always. At least the polycrust remedies like aconite, rustox, sulfur, sepia, natramur, tubovinum, medorinum, all these very pulsatilla, silicea, sepia, all these important polycrust, at least you have to read the Boric first paragraph. So this is indicated in renal affections, but caution is necessary for where skin and intestines do not perform normally. Even high potencies are dangerous. This is from tubovinum itself. And if you see tubovinum, first line, tuberculinum, is indicated in renal affections, but caution is necessary for where skin and intestines do not perform normally, even high potencies are dangerous. So, last question, catarrh of middle ear, discharge acrid, smells like fish pickle, very important characteristic. So, answer is tellurium. If you see the Boric, eczema, the ears symptom, eczema behind ear, catarrh of middle ear, discharge acrid, smells like fish pickle. This is our question, tellurium. So this is all about the Materia Medica answer key, and coming days we will be uploading the analysis of the question paper and the organon answer key, repertory, pharmacy and the practice of medicine answer key, along with the kind of analysis of different levels of difficulty of the question. Comparatively, Materia Medica was very easy this time, and all the best wishes for all those who are preparing for the coming year's exams.